Recently, something got attention at Essentia Health, a giant inflatable walk-through colon. While it may seem unusual, Essentia uses this colon to educate others on the importance of colon health. It could also be a lifesaver, as colon cancer is the second most common cause of cancer death in the U.S.
Colorectal cancer starts typically as a small polyp within the lining of the colon, and then that grows, and then eventually it can turn into a colorectal cancer.
Dr. Kimberly Kolkhorst, a gastroenterologist at Essentia Health, says about 1 in every 23 people develop colorectal cancer. But if caught early, the 5-year survival rates are 90%.
This is an important statistic because with colon cancer screening, if you have a colonoscopy, then 90% of these polyps or colon cancers can be removed at the early stage.
Risk factors include being over the age of 50, the use of alcohol and tobacco, lack of physical exercise, a low-fiber diet, having a family history of inflammatory intestinal conditions, or colon cancer. Dr. Kolkhorst says there are some things to watch out for.
Typically, the symptoms that we look for could be a change in bowel habits, meaning you can have constipation or diarrhea. You might see some blood in the stools. You might have abdominal pain. You could have unintentional weight loss.
But sometimes there are no symptoms, which is why it's so important to be proactive and schedule your colonoscopy if you're over the age of 50 or earlier if you're having symptoms.
Colonoscopy is one day that can save your life. I've had so many people tell me it definitely beats having to have surgery and chemotherapy. So to come in and get your colonoscopy done, you'll have the peace of mind, you're good for either 5 or 10 years, and that is worth it for many people.
The good news is colorectal cancer survival rates are high when caught early. So if you have a family history or are over the age of 50, it's important to get screened. With this Essentia Health Medical Insight, I'm Tracy Briggs.